Welcome to All Things Cardio-Oncology. My name is Steve Caselli. I'm the Executive Director of ICOS. And on our podcast this year, we are introducing a new series that we're calling Heart to Heart. In this series, we'll be speaking with patients and the healthcare providers who treat them. Our hope is that you'll be encouraged and empowered by their stories, whether you are a survivor, a healthcare provider, or a supportive family member or friend. So thanks for joining us on this episode of Heart to Heart. And today we're talking about something that many people don't hear enough about, and that is the patient experience in cardio-oncology, where heart health and cancer care come together. And as usual on this series, I want to welcome my co-host, Dr. Susan Dent. She is the president of ICOS, a breast cancer oncologist, and really a world leader in the field of cardio-oncology. Hi, Susan.
Good morning.
Our guest today is Taryn Cox, who is from South Africa, where we will soon host our annual meeting. She is an artist and a teacher who's been through a really remarkable journey related to breast cancer and cardiovascular complications. So, Taryn, thank you so much for being willing to share your experience with us today.
Oh, thank you for having me.
Well, you and I spoke previously a little bit about your history, and I think one of the unique challenges you faced was that you were living in quite remote areas of Africa when you were first diagnosed. So I wonder if you could just sort of back up and set the stage for us in terms of where you were at the time, what were the first signs that something might be wrong, and then, what was it like, receiving this diagnosis when you were remote from really large hospital facilities and care facilities?
Yeah. So my husband is a forester, which means we've lived mostly in remote areas. If we are in a town, it's a small town in the middle of nowhere. And we were living in rural Eswatini at that time. We'd moved there in 2011. We'd been living there for 2 years. It was idyllic. It was beautiful. For an artist, that was lovely. I mean, I was in the middle of nowhere. Our house was only accessible using a 4x4. Completely rural life. I had to learn to bake my own bread, and just the problem came when my son started school. So he was 5 years old and he was going to grade R, and we had to enroll him in the school near the capital in Mbaban. And that was about an hour and a half away. So he and I stayed there in the week and only went home weekends. And I began having strange breast pain. It was, I was large-breasted. Breast pain was kind of a fact of life, but this just felt different. And I decided I needed to go and see a doctor. My maternal grandmother had breast cancer, and my maternal aunt was battling it for the second time. And but going to a doctor in Swaziland wasn't easy. You couldn't make an appointment. If I wanted to see a woman doctor, which I did, then there was only one, Dr. Mkonazi. So I could wait all day just to see her. But I made arrangements for my son, and I went along, and I thank God that I had a doctor that took me seriously, because we couldn't feel a lump. I couldn't feel a lump. She couldn't feel a lump. But based on my family history, she took me very seriously. And she said straight away, you need to go for a mammogram. I was only 36, so I hadn't had a mammo up until then. And I was put on a 6-week waiting list, but she called straight away and said, please take this case seriously. I want her on a cancellation list. And I ended up being able to go across the border to South Africa to get a mammo 2 weeks later. And they did find an irregularity, a minute, it was under a millimeter, which is why I think we couldn't really feel it yet. I was referred for a biopsy, and the biopsy came back positive. We opted immediately for a lumpectomy, because as the surgeon said, I can't send you back to Eswatini with that thing in your breast. So I went in thinking, well, it's just stage 1. It's such a small little lump. We've caught it early, yay, and went under the knife. And when they opened me up, they found that there were malignancies in all my nodes. So I woke up to the news that I was actually stage 3. It hadn't spread to any other organs yet. But yeah, it was quite a shock. And 36 years old, 6-year-old son, and I was having to have treatment across the border and then go home. So my son had to be pulled out of school. It wasn't easy. Wasn't easy. Yeah.
That's really challenging, as you mentioned, because of where you lived and where your treatments were. Can you just describe a little bit about what treatments did you have to face, particularly as you said, you were juggling your son and schooling and how that affected your life, and how did you juggle all of that? It was a lot.
Yeah, look, it was tough because living in Eswatini, rural Eswatini, we had no family there. I had family across the border in what we then called Nelspruit. It's now called Mbombela. So I had family living there. And so I actually, the first oncologist I saw reduced me to tears. He was very rude, very patronizing. And he actually told me I had 2 years to live. He said, prognosis, you'll be dead in 2 years, is what he told me. And I wouldn't speak to him again. I actually turned to my husband and said, I don't want this doctor to have my life in his hands. Get me someone else. And I ended up going to another doctor, the only female doctor in that hospital. And she was amazing. Completely different attitude. Straight away, she said to me, this is the treatment plan. When things get tough, I want you to look at these graphs. If you do this, this is the percentage chance of it recurring. This, so she said, we're going to fight this. I felt like she was in the trenches with me. And we started off with quite an aggressive chemo treatment because I was, other than the cancer, relatively healthy, very fit. Walked and swam every day. So I was fit and healthy. And so Dr. Atif just said, well, let's, instead of the 3-week break between chemo sessions, we'll just have 2. And we're going to really knock it to try and stop it progressing to stage 4. So my chemo treatment was quite aggressive. What would happen is I would leave the day before from Eswatini, travel really, really bad roads for about an hour and a half till I got to the border crossing. Would get across the border, stay with someone the night before, then leave really early to travel an hour to the hospital in South Africa. And I would have bloods. If the bloods were okay, I'd have chemo. And then once the chemo was done, I would get into my car and race to get across the border before it closed at 4:00 in the afternoon and before the side effects would hit, because the first night I always had terrible migraines. So and that was my pattern. I ended up having 4 adriamycin treatments, 4 Taxol, and then when I had the radiation, it was daily 6 weeks. So I had to live in South Africa. I had to leave my family for 6 weeks. And look, my son, we'd had to pull my son out of the school at the capital. So he had to go to a little local Swazi school. And he was one of 2 non-Swazi speaking children in the school. Little mud brick school. They were so sweet. They were beautiful, really. I mean, every Monday in assembly, everyone had to stand up and pray for Connor's mom, and just really lovely. And Philip had to work, my husband, so the teacher had contacted him and said, she will keep Connor in the afternoons and do his homework with him before, so that my husband could come fetch him in the afternoon. So I just had I think I've always been lucky that although I didn't always have family around, there were always so many people who just stepped up to help. I got to know the border officials incredibly well. They were lovely. They in fact, exactly a year from diagnosis, when I was going across the border to see if I was in remission, I came back and they were all waiting to hear, especially the Swazi officials. I really got to know them well. And I said, yeah, doctor says I'm clear, I'm in remission now. And they started singing and dancing, and my son was with me. And so in honor of the moment, they gave him a Swazi name. They started calling him Nkosinati, which means God is with us. And yeah, so he was given the Swazi name to commemorate. So I had so many incredible people who supported me in small ways. But yeah, it wasn't easy for any of us, for my son, for my husband, for myself, having treatment basically 2.5 hours away. Yeah, and that became quite problematic, especially when the cardiac issues started rearing their head. So
that's what I was going to ask you next, is when did you start to become suspicious that something was wrong with your heart? You said you completed your treatment, you
yeah,
had the surgery, radiation.
yes. So during the radiation, while I was lying in the machine, I was having these instances where I really couldn't breathe. And unfortunately, I'd been very open with my doctor right at the beginning and explained that I'd had a history of anxiety and depression after my son was born. I wasn't on any medication, but I'd been very open about it. And she and I had agreed that perhaps it was best, while I was fighting the cancer, that I go back on meds for anxiety and depression. So it was all in my chart, which is good, but in a way it colored everyone's perspective, because I started having these breathlessness, these attacks where I really couldn't breathe, and I had this heavy pain in my chest, and they kept being dismissed by everyone, including myself, as panic attacks. And my aunt, that had been re-diagnosed just as when I'd gotten diagnosed, she had died while I was having treatment. I wasn't able to see her, wasn't able to attend the funeral, because I was literally fighting the same disease. So I was going through a lot. I was living away from my family. My son was little. He was crying every night. It wasn't easy. So everyone just dismissed it as anxiety. And then when I was given an exit medical at the end of my radiation, that was the first time I had a thorough examination, and my resting heart rate was sky high. And suddenly the alarm bell started ringing. I think there were numbers like 175 heart rate. It was bad. Amazingly, I was allowed to go home, and we actually crossed the border. But I got across the border and I was battling to breathe, and the Bulembu road was so bad. I actually called my husband and asked him to please. So we parked my car and he drove me home from the border. But the next day, it was so bad. I couldn't stand upright, could barely breathe, was in and out of consciousness. My husband phoned my doctor and she just said, "Get her to the hospital now." And the border officials were incredible. We phoned them. They were waiting outside at the border post with the stamp, so that we didn't have to get out, queue, anything. We literally just held passports out. I don't remember this. My husband tells me this. I was very out of it. And we arrived at the hospital. I went straight into cardiothoracic ICU, and I was there for 8 days while they stabilized me. And that was my first diagnosis of having cardiomyopathy and being in cardiac failure. And from there on, it became something that we had to manage with the cancer. Because although the aggressive treatment was finished, I was still on hormone therapy and still recovering. So yeah, it wasn't great. And the cardiac issues became a bigger and bigger issue going forward. yeah, I've been in and out of ICU a few times since then, so become a regular ICU unit.
If you or your institution would like to have credentials that confirm your qualifications as a cardiologist or as a Cardio-Oncology Center of Excellence, we encourage you to apply for our certification exam in Cardio-Oncology or our Center of Excellence certification. This is a unique opportunity for you or your institution to distinguish yourself, recognizing your expertise in the field. More information about both of these opportunities, along with all our other programs, can be found at ic-os.org.
So as you said that, you developed a cardiomyopathy or an enlarged heart and heart failure, which I assume they thought was due to the chemotherapy that you'd had
Yes.
for breast cancer. How did you get connected to Dr. Singh and his team, and what changed for you once you found that team in terms of moving forward with your overall health?
Yeah, well, I should just mention that the first diagnosis, there wasn't even a cardiologist at the hospital, let alone one with any knowledge of oncology. And that was one of the first instances where I made judgment calls and then ended up saying, well, then I want a cardiologist in Joburg. And I would drive 4.5 hours out of my way to go and see a cardiologist. So finding the right doctor was it's something I learned very, very early I had to do. So we have to fast forward a bit to 2019. And at this point, I was living in a small Southern Cape town, forestry town, but my husband was actually at this point working in Indonesia. There'd been massive fires, forestry fires, and mass retrenchments, and so he was working overseas. And in this time, I had found out I had the BRCA2 mutation. So I was in communication with a surgeon in Joburg to have a mastectomy. And I went for a checkup with my oncologist in Knysna, where I was staying, and my marker had spiked. So I'd been supposedly in remission for the past 5 years, simply on hormone therapy. And they sent me for scans, and they found that the disease had metastasized to my spine. I had lesions in my sacral and lumbar spine. So, and I was quite angry because I'd been telling my doctor for a year that I had back pain, and I hadn't been sent for a scan. And he also then said to me that I should cancel the breast surgery because it was a case of closing the barn door after the horses bolted. The disease has recurred. What's the point? And when I phoned my surgeon in Joburg, who I'd chosen because he was a really well-known doctor in the breast cancer world, Dr. Saruria, when I told him over the phone, look, my doctor says it's no point anymore, he hit the roof. He said, has he even seen if there's a new primary? What you can't? He said, please, I'm begging you, come to Joburg. I'm going to set you up with a different oncologist. You need someone else taking care of you. So I was referred to Dr. Ronwyn van Eerden, and I saw her. Completely different story. I got sent for scans. They did find a new tumor in the left breast. And she and Dr. Saruria worked incredibly closely. And for my mastectomy, they actually even brought on not only an anesthetist, but a cardiac anesthetist. And there were all sorts of meetings and consultations. So when I went in for my 4-hour breast surgery, I had 6 doctors involved in this. This blew my mind. All top of their fields, and here's little old me, and they're all trying to give me. It blew my mind that they would care this much. So it was wonderful. But from a practical point of view, at this point, I was really struggling. My husband was overseas. Every time I had surgery, my son, who was in primary school at this point, someone would have to come and look after him. I had no family in Knysna. Knysna. For me, even to get to my doctors in Joburg, I had to drive an hour from Knysna to George, fly from George to Joburg, catch the Gautrain to from the airport. It was just insane. So I decided to relocate to Durban, where all my family is. But I said to Dr. Van Heerden, if I go to Durban, I want a doctor like you. I want a doctor that thinks like you about my care. I want someone who's going to be on the same page. So she referred me to Dr. Ria David. And my first consult with Dr. David, she said, Taryn, you're not going to believe this. There is one oncocardiologist in South Africa, and it's Dr. Trishan Singh, and he is here, and I'm referring you to him. So I got to see the only oncocardiologist in the country. And so he and Dr. David worked together, and they've been taking care of me for 5 years now. To the point that if we have to discuss a new onc treatment, because eventually they stop working, then, if Dr. David's unsure of how this might affect my heart, she'll be chatting to Dr. Singh on the phone while I'm in the room. I've got two doctors that actually work incredibly closely together. So, I'm very, very lucky.
That's just such an incredible journey. And I think what really sticks out is all along different parts of that journey, you've had to really advocate for yourself. Not only were you challenged by geography and the distance that you had to travel, but as you mentioned, at different points, you had healthcare providers that weren't encouraging, right? That actually discouraged you. And yet, look at where you are here today. You are living, right, with advanced cancer, but also obviously, doing fairly well and enjoying, your life and your son and so on. So from everything you've been through, which is an incredible story, what can you sort of pass on to those people who would be listening to this podcast in terms of individuals speaking up and asking questions and trying to make sure that, they're getting the best care possible?
Yeah. No, listen, the first doctor I saw did me a favor by being a jerk, basically, because I think from that point on, I realized I had to go looking for the care I wanted. It wasn't always possible, but as far as possible, it was. I mean, the medical world can be intimidating if you're not medical. I mean, I paint and I teach English. I don't have a clue about this stuff, but I learned to trust my gut, and I learned to that I wasn't going to tolerate being treated horribly. I might not be a doctor, but this is my life we're talking about. So getting that mindset right of I actually have a right to demand a certain level of care. So I mean, not that I'm aggressive or anything like that, but I just learned to trust my gut. And if I feel I'm not getting the care that I'm comfortable with, I have learned, and it's gotten easier. I've learned to go looking for what I want. And I feel like, if I can do it, if I could do it where I have to drive hours out of my way, fly, and, it costs so much, but it's your life. There's nothing more important than getting the good care. I've gotten better at spotting the doctors that I can rely on and trust. So I think it's a red flag for me where I have a doctor that doesn't want to ask someone else for their input, where it's ego before patient. Every time I've had that, I've received substandard care. I think doctors who can keep accepting that there's something to learn and that someone else might know something they don't, and they don't have a problem with bringing more doctors on board. I think the kind of doctors that would listen to a podcast of a patient from the middle of nowhere, those are the doctors you want, because they're not caught up in what they know. They're caught up in doing what's best for the patient. So I think that has become incredibly important. But aside from that, I think also I would say to people, you also can't give up hope. If I had gone, oh, well, I'll be dead in 2 years, what's the point? I've always just had an incredibly positive mindset. My son and my husband say I'm too stubborn to die. I just am determined, and I think life is just so incredibly beautiful, and so many people are good, and I just keep celebrating it. But aside from that, it's also practical to be hopeful. Things that I can remember trying to get onto drug trials, which I didn't qualify for, and 2-3 years later, they're standard treatments. So the medicine changes all the time. Things that were not vaguely a consideration 12 years ago are standard care now. So I also say to people, don't give up hope. You have no idea what's around the corner. I've come close to dying more than once, and somehow something happens and I rally and I'm here. And yeah, so I think finding good care, finding good doctors, and then staying positive and hopeful is the best thing you can do.
I think you raise some very important points, and particularly around, the healthcare providers who think that they know everything and they don't need to confer with their colleagues. And I think one thing that the International Cardio-Oncology Society really tries to illustrate is that we need to work together as a team. And that means reaching out to your colleagues, whether they're in your own center or even internationally, when you are faced with a clinical situation that's difficult and you want to try and provide the best care. And I think that is what collaboration is all about. And as you said, and I am a breast cancer oncologist, things are changing very quickly, but with those changes come new challenges. And these challenges can be around new therapies and their impact on the body, including the cardiovascular system. So we need to continuously be working together to try and make sure that people are well enough to have those cancer treatments, and that we don't have to stop them because of cardiovascular issues.
Yes.
So your words I think, are very well stated. I do want to ask you, how are things now in terms of your heart health, and where are you in your journey? You seem to be doing extremely well, but maybe just give us an update.
It's almost miraculous, to be honest. Last year I was bedridden. I hardly got out of bed last year. It was very, very difficult. We were doing Taxol chemo for the second time. And at this point, quite weak. My ejection fraction for my heart is 37%. I know there are other measurements. I can't remember their names, but, so my heart health isn't great. But I was put on a new drug that actually isn't even registered in South Africa yet. And it's specifically for people with the BRCA mutation. The name of it is Lynparza. I don't know the medical term for it, but I was put on that, and at first was incredibly sick. But after about the third month, I started being able to tolerate the drug. So January this year, I was still bedridden. And March, I was out of bed. I was off my duodesic pain patches. I was up and about. I mean, my son can't believe it, because for the last 2 years, I haven't really been able to fetch him from school. I'm now fetching him from school, making school lunches, doing all those mom things. So it's actually been incredible. So last year I had to put a living will in place and have some hard discussions with my husband because it was looking so dire. And I've rallied miraculously. I know my last cardiac checkup with Dr. Singh was pretty good. It's, as he says, you're holding your own. So, it's not necessarily that I'm doing brilliantly and I'm going to run a marathon, but I'm holding my own. I can climb a flight of stairs and breathe. So, So I'm doing okay. And I've been able to get painting again. I've kept painting, but very small. I'm teaching an art group again, and working on some really big oil paints, which I haven't been able to do before because they were just so physically exhausting. But now I'm working on large commissions for oils. And yeah, my son's in his final year of school. I mean, it's astounding to think this journey started when he was 5. He's now 18. And he's in his final year. So I got to see him go to his matric dance, which is, I think, prom is your American equivalent. And he's busy writing his final exams for matric. And we're finalizing placement for university next year. And getting to experience it all, I just can't tell you what that means. It's just amazing. It really is. Yeah, there's just a lot of good stuff at the moment.
That's just incredible. And I think it really speaks to what you said earlier about hope.
Yes.
That you've had some very rough times, but you were hopeful and you continued and sought out different treatments, and look at where you are today. And none of us can predict the future.
No.
I think, as you mentioned, you have become to appreciate how precious life is today and to enjoy the health and what you have today. And that is just, I think that really illustrates what you've told us, really illustrates how important that is.
Absolutely. Absolutely. Yeah.
So if someone is listening to this podcast and they're just starting their journey, what encouragement would you want to share with them?
I'd say, yep, don't give up hope. Don't give up hope. I think that's the most important. I actually am involved with a few groups where people are diagnosed and then they get my number and they call me and they're totally overwhelmed. And the first thing I tell them is cancer is not a death sentence. Don't assume you are now going to die. It is a tough fight, but it is a fight you can win. And you can't give up hope. You have to just stay positive. And I think it helps them to see someone who's stage 4 with liver and bone metastases, and I am living a fairly normal life. I mean, I'm not quite able to do the work I used to do, but I'm involved in my church. I'm involved. I have a lovely family. We have get-togethers every weekend. I'm able to attend most of the time. Life is good, and I think it helps them when they're, say, stage 2, just being diagnosed, and someone like me turns around and says, cancer is it's not a death sentence. Don't assume you're going to die. I think I also like to tell people that there's a difference between not dying and living. And you have to find the balance. There are times where you have to focus on not dying, and that's dealing with the medical stuff and dealing with the medicine and the side effects. It's not always nice, but don't forget the second part. So, absolutely relish the things that make you feel alive, which in my case is my family and my art. An avid reader. I love particularly doing landscape painting. So just sitting and sketching in my sketchbook, if that's all I can manage. But I do the things that make me feel alive. I don't sit around, woe is me. It's just, there's no point. So you just keep feeding your soul and you trust your doctors. If you don't like your doctors, find better ones.
I think that's so well put when you say it's not just about, surviving your treatments and not dying, but it's about living.
Yes.
And it's so important that you've had some very rough times, but they've got you to points where you can live and enjoy life. And that then at least is a partial balancing for all the things that you've had to go through to get to this point.
Yes.
So, incredible incredible story, and I'm so grateful that you were willing to share this with us. And I'm hopeful that other individuals that are facing these challenges will have a chance to listen to your encouraging words. And that, as you said, it's about living and it's a journey. Don't give up and maintain hope because things are always changing. And it's important that we work as a team, as the person living with cancer or having treatment and the healthcare providers. It really is a team working together to try and give, that individual the best quality of life that they can.
Absolutely. Absolutely. Oh, and I hope it helps. I really do. Yeah. I know that Dr. Singh wants to bash his head against a wall because there's so many cardiologists and oncologists that won't work together, and he's desperate to get more and more. And if I can shout it from the rooftops, just to say what a difference it makes when you have a team of doctors, not just a doctor, it really does make a difference.
You're right. And understanding that what we do as, cancer physicians does have an impact on the rest of an individual's body, including their cardiovascular health. But if we can try and work together and hopefully, prevent some of the issues that you faced with your heart, the chemotherapy that you had, ideally, if we recognize this as an issue, what can we do to even try and prevent this from happening in individuals if we can?
Yeah, absolutely.
So thank you once again. And Stephen, I'll let you close out this session of Heart to Heart.
Yeah, I was just going to say thank you so much, Taryn, for being willing to be vulnerable and share your personal experience. I know it's going to be a great help to everybody who's listened. You've given us some great advice. So thank you so much for being with us today.
Oh, thank you for having me.
Thank you for joining us on this episode of Heart to Heart. And if you would like more information about any of the ICOS resources or opportunities, go to ic-os.org. That's ic-os.org for more information.
Free audio post-production by alphonic.com.